Hello, I'm Faye Waterman, and we're doing a Facebook Live today with Helen Ronenberg, our block therapy instructor. Now, I'm wanting to learn more and help you learn more about what block therapy is. And Helen is going to teach us a little bit more about what block therapy can do for you. So Helen, what causes pain in the first instant? And there's lots of reasons for that. But what can block therapy do for that?
So from a block therapy perspective, all pain is caused by a lack of blood and oxygen to our cells. So it's the language of our cells saying, help, I need something. I'm either hungry or I need attention. Similar to, when we have a baby that's crying, we know that the baby's crying because it has a need. It's either hungry or dirty or needs attention. And that is essentially what pain is. It's the language of our cells telling us that there's something wrong and they need attention.
Makes sense, doesn't it?
Yeah.
There is something wrong.
So it's like that traffic jam, right? If you're trying to get from A to B and there's a traffic jam, you have to first clear the traffic jam before you can actually get there. And the adhesions or in our fascia is what the traffic jam is, and that's what's causing the block to blood and oxygen to our cells.
Exactly. And okay, so how does block therapy stop or ease that pain? What do you do with those blocks? And I hope you've got your blocks there so that you can show people.
Yes, I can show you what. So this is the baby block, the little one, and then we also have another size which looks like that. So essentially, that's what the block looks like.
Okay.
So how block therapy helps, because there's, one of the things that, sorry, let me start. The adhesions in our fascia is caused by the scar tissue that we get. And we get scar tissue through numerous ways, right? We either injure ourselves or we have surgery, and that's what causes the scar tissue, and that's where the fascia starts to grip onto, causing the blockage. And the other way that we have get adhesions is through compression, because we're always sitting forward. We have gravity that actually works on our bodies and pulls us down to the ground. That's then making or compressing the fascia. And as soon as the fascia compresses, it becomes thick and hard. We also have that our the tissue's got a certain temperature. Now, if you think of anything that is cold, it freezes. And if you look at frost, it kind of like freezes out, water freezes out in like a spiral manner. And that's what happens to our fascia, specifically in our forearms and our hands and our lower legs and feet, because our diaphragm or our breath, when we push in oxygen through our body, it's done through our breath. Most of us are breathing through our chest and not through our diaphragm. Now, our diaphragm's in the middle of our body, funny that, and it's the engine of our body which pushes all the energy to get all the blood and oxygen to all the various parts of our body.
And how many kilometers? Do you know how many kilometers that breath takes to, travels around with all the circulatory system around the body? It's quite a distance that it has.
Absolutely,
to travel. Yeah.
And if you look at a baby, the baby is breathing diaphragmatically. Most babies do, but then as we grow older, we start breathing through our chest, and we actually lose that. So yes, and we, when we get a fright, we breathe always from our chest. You've heard most people say breathe deeply, and even when we breathe deeply, we're doing it like this and not from our belly. Yeah. So our diaphragm gets weaker because it's not doing that. When we're using our diaphragm and we're breathing in, we push the diaphragm down when we breathe in, and that makes our belly go out. And then when we breathe out, it pushes the diaphragm up into our rib cage. So what then happens is it becomes very frozen over. Our fascia becomes very frozen, and this then causes it's like, say, for instance, if I was holding your arm and this is where my fascia is gripped and I'm pulling, eventually this muscle is going to get really tired and it's going to start hurting. So what happens is we go to traditional ways of looking at the problem, and we go for a massage, or we even have surgery here. And it feels better, right? But because we're still pulling here, it's not long, and then the issue reappears because we've still got that pull. So with block therapy, we're releasing that pull, we're heating up the fascia so that through the diaphragmatic breathing, so that it doesn't get so compressed here. And then our arms can move, and then the pain goes away that we experience in our back.
And is that like referred pain? I mean, you can have pain in your shoulder, which moves down your arm, or pain in your back, which causes sciatic nerve pain and all that sort of thing. And when we are breathing, if we were breathing correctly, we'd have a lot, we wouldn't get as tired because we would have more oxygen going to our brain. So that release of tension using block therapy